and I'm going to tell you about my experiences with the coronavirus. So I found out I was positive for the virus during August, and I was told before I was positive, I was already scared of the virus because it wasn't as large as it was before as now, and so I didn't take that much precautions. So I was put in a room by myself with my dad, so we can self-isolate, and it was hard. At first, I was frustrated because I love socializing with my family, with my friends, and my neighborhood. So that really took a big toll on my life. So when I first got in, I was pretty frustrated, and I had to stay in a room with my dad for 10 days, which wasn't really paradise, but you gotta do what you gotta do. And even though I didn't have any symptoms, like I was asymptomatic, I had to stay in that room. And although I couldn't physically hang out with my friends, they called me and played with me with online, and they told me you could get through it, stuff like that. So I want to give a shout out to them. And after I got out, the minute I got out was the best day of my life because I got actual fresh air, and that's why I think that it's important to self-isolate, even though it's going to be hard. And since then, I've been taking the crushes more seriously and more attentively because I don't want to be in that situation again. And to everyone that's seeing this, I just want to say that you gotta be careful, wear a mask, wash your hands, stay 2 feet apart, and never stop fighting the virus. Thank you.
አብራችሁን ስለቆያችሁ እያመሰገንኩኝ በቀጣይ ከአልበርታ ሄልዝ ሰርቪስ የሜዲካል ኦፊሰር ኦፍ ሄልዝ የሆኑ ዶክተር ለቃለም ጠይቅ አቅርቤያለሁ። ዶክተር ክርስቲን ኬኔዲ ፊዚሻን ናቸው። ከእሳቸው ጋር ያደረኩትን የእንግሊዝኛ ቃለም ጠይቅ በቀጥታ አቀርበዋለሁ። የተመልካች ጥያቄ ካለ በሚቀጥለው ሳምንት ወደ አማርኛ መልሼ ለማቅረብ ፈቃደኛ መሆኔን ከወዲሁ ልገልጽ እወዳለሁ። እንድትከታተሉ እየጋበዝኩኝ በቀጥታ ወደ ቃለ መጠይቁ ወስዳችኋለሁ።
Doctor, first of all, thank you so much for your availability for this interview.
It's a pleasure to be here.
The ZE-SHEGER multimedia tube. It's a social platform, and this is a COVID-19 awareness program presented in collaboration with Calgary Ethiopian Community Association. Our today's discussion will be on topics that I believe will help and create awareness for the intended purpose. If you're okay with that, we can go ahead.
Yes, let's begin.
Without further ado, I will proceed to the interview. Let me start with asking you, can you tell us a little bit about yourself?
I'm one of the medical officers of health. I'm a physician. There are 5 medical officers of health in Calgary zone, Alberta Health Services. I believe your community is probably familiar with Dr. Etches, who is our lead MOH for Calgary zone and who was very involved supporting your community back in the early fall and mid-fall. I have been an MOH for many years, but moved down to Calgary zone in 2019 from Wood Buffalo region, so Fort McMurray, where I had been an MOH for a few years.
Welcome to Calgary. We need people like you. We're talking about COVID-19, like I said, but let me have some grip from the back history. Back in February or March, I have seen many countries, big cities, their streets being washed, their high-rise buildings up to 20-story being disinfected. The outside of that high-rise building, it's not at a human reach, and we're not Spider-Man jumping around. So when I see that, sometimes question strikes in my head. Is this virus airborne?
Well, up until about November time, it was recognized as being droplet, which meant that it was spread on small droplets which were issued from either the nasal passage or the nasopharynx, so also the mouth. And it was believed that these droplets would essentially settle out within 2 meters of the person who had issued them. There has been some research which was discussed by the CDC, the US CDC in Atlanta, around the possibility of these droplets extending beyond, having viral particles that extend beyond that 2 meters. And there was a warning put out by the US CDC in November with respect to the possibility in certain circumstances where the viral particles that can transmit the virus could travel more than 2 meters. But those circumstances are very rare. And so it led to the Public Health Agency of Canada, Dr. Theresa Tam, putting out a warning with respect to the possibility in certain circumstances where the air exchange is less, where that is possible. However, the majority of the transmission does occur within that 2 meter distance from the person who is issuing the viral particles.
So if there is still a chance that the virus can travel more than 2 meters, why do we limit the social distancing at 6 feet or 2 meters then? Why not like 3 meters?
Yeah, certainly it was proposed that that be considered. In terms of the Scientific Advisory Committee for Alberta did consider the literature and the most recent publications on that, for that issue, and made the recommendation that no change needs to occur currently under most circumstances for that 2 meters. The only circumstance whereby the Alberta scientific community acknowledges that there could be airborne viral particles that are viable to transmit the virus would be if someone was performing what's called an aerosol generating procedure. So an intubation, where a tube is put down into someone's pharynx in order to allow them to breathe. Those procedures generally happen within acute care, within hospital, and within certain circumstances in essentially healthcare facilities, and additional precautions are taken by the individuals who could potentially be exposed.
Well, there's also, there's no final conclusion about the behavior of this virus. Last week, I had an interview with a family, a mother who told me that her son is diagnosed with the virus, but the rest of the family were not. Before they find out, they were cuddling around, they playing around, they were hugging around, even sharing seats and sharing tables while dining. And how do you say this?
Well, the transmission potential is variable for a whole bunch of different environmental reasons, but there's also the host characteristics. So the individual who is exposed to viable viral particles and then may or may not develop the condition or the disease. And this varies. We know it varies on age. We know it varies on comorbidities, so other conditions that someone might have that may either predispose them or protect them from developing the disease if they are exposed. Immune competency, so having a competent immune system is also very important. And we know that there is, like I said, variable transmission potential depending on the host's characteristics.
So what kind of people are at high risk from exposure to recovery?
So in terms of at high risk of developing the disease if they are exposed to some viral particles, that would be vulnerable persons. So we definitely know in terms of persons who are at higher risk of developing the disease once exposed, as well as individuals who are vulnerable at developing severe disease once they do get the disease. So in terms of vulnerability, anyone who is immunocompromised, and that would be individuals who are at increased age. So generally we're seeing as an individual over the age of 70 to 75, individuals have a higher rate of disease as well as severe disease. And so they have a higher likelihood of ending up requiring hospitalization or ending up in the intensive care unit to be supported for breathing.
So how about pets? Do they transmit or do they get the virus?
There's been very limited publication on the potential for domestic pets, so cats and dogs. We know that there's a possibility for them to develop the disease, the virus. However, they have not been known to transmit the virus if they are infected. So it really is, all the cases that I've seen published in the literature talk about that the pet owners are likely the ones who were originally infected and then can transmit it to the pet and not the other way around.
Yeah, so the reason why I mentioned is if a family member is infected, we can't control the movement of pets sometimes unless we lock that person down. Now I have to come straight to how we can protect ourselves from this virus and from the particles.
Absolutely. So generally, the 5 ways that we can protect ourselves and protect our loved ones from being exposed to the virus have not changed since very early on in the spring. The very first thing is wash your hands, wash your hands, wash your hands. I mean, really, hand hygiene is the single most important protective measure and preventive measure for the transmission and exposure of this virus, especially since it is primarily droplet transmitted. The second would be more recently, certainly the restrictions and the requirements for masking when individuals are out in public in an indoor situation, we are required in all of Alberta to wear a minimum of a 3-ply mask. Homemade masks are okay. And that is also helping to protect not only yourself, but protect others from being exposed. The third is early recognition of symptoms, early testing, and subsequent isolation. Really to be responsible in terms of reducing the exposures that come if you are yourself infected, in order to protect your loved ones and those around you, your co-workers, from being exposed. So number 4 would be continuing to observe other restrictions from indoor gatherings that have been put in place in Alberta, as well as coming up on the holiday season, restricting the any indoor gathering to a single household. So those individuals with whom you regularly reside and live. So those are generally the 5 things that we do almost every day to help protect us and our loved ones from being exposed and transmitting the virus.
Talking about like cleaning hands, how often and after what activities should we clean our hands?
Well, generally, if you were to ask a school, for example, how often are the children encouraged to wash their hands, they're saying anytime they think of it. So there really is no maximum number of times that you're going to do proper hand hygiene. And the more often you do it, the less likely there are to be viral particles on your hands, which then can be where you can inadvertently touch your nose or your mouth, your eyes, and have that virus introduced into your body. So wash your hands every time you think about it. Even put your alarm on and for every little while, so that you are reminded to wash your hands again. There really isn't any maximum number of times.
Sure will. How effective are the masks?
How effective? Yeah, that's been highly contested. Certainly, we were discussing it at length back in the summer when the municipality, so the city of Calgary, were considering a masking bylaw. City of Calgary were one of the first in Alberta to introduce a masking bylaw for indoor areas. And when we were debating it and discussing it and providing advice to the City of Calgary and the decision makers on the municipal level, we encouraged them to consider it not as a standalone measure, but as an additional measure that people can take in order to further protect their loved ones and themselves. It's difficult to give us like a number or percentage reduction, absolute reduction in risk due to the masking, because we don't really have any natural experiments where only masking was used as a control measure against COVID. What we have seen and what is very encouraging is that this fall, normally we would see a lot of influenza A and B being transmitted throughout Calgary and Alberta, and we have not seen any. So the masking, the hand hygiene, the limiting your exposures to others, all of those actions are resulting in no influenza right now and are being circulating in our communities, and that's a real testament to the effectiveness of the control measures that people are adhering to and putting in place to protect their loved ones.
There is a list of approved masks on the government website. I checked on Canada.ca.
Yeah.
And every time we go shopping, we might not have access to internet, or, who will do that? Do you have any advice about what type of fabric do we choose when we buy
Right.
masks?
Yeah, so Dr. Teresa Tam, back in the summer as well as in the fall, provided some guidance over homemade masks in particular. So using a tight woven fabric. There was a lot of talk in the summer over natural fibers, so a tight woven cotton or tight woven linen fibers, and then using a polyethylene filter as the third layer on the inside that can be removed and cleaned. A lot of individuals may not necessarily. I remember back in the spring and in the early summer myself trying to go and find, for example, elastic to make the ear loops. My teenage daughter downloaded some patterns of masks from the internet and was making them on my sewing machine, but we could not in Calgary find any elastic because everyone was out buying elastic to put around the ear loops. It's a little bit better now. I think a lot of stores have brought in additional supplies that are required to make them according to what Health Canada is advising and the Public Health Agency of Canada are advising. But generally, the three-layered mask with potentially a removable, cleanable filter layer in the middle is acceptable. And in terms of the masking bylaw in Calgary, it was simply a face covering. So it doesn't necessarily have to be a mask per se, but any face covering, which would include scarves as well as bandanas.
You mentioned that the mask is the most effective compared to others. Of course, cleaning, they all go beside each other, but the mask was effective. And recently there was some restrictions that we can't even go. Cafes, bar, restaurants are closed. We have to choose one. If the mask is effective, like you said, they have to let us free. But if the mask is not confidence to protect, we have to stop wearing masks. And why are we wearing it?
Well, because it contributes. And this is what I was saying before, is that it's hard to say exactly what percentage of the absolute risk reduction is contributed by a mask alone. And so it's the many layers of control measures that have been put in place which contribute to better control and risk reduction of transmission. There are some municipalities in Alberta and actually within Calgary zone who have even adopted a mask bylaw for individuals who are outside. So not even in indoor spaces, but outdoor spaces. Anyone who's going to be visiting Banff and Lake Louise in the next last little while and the next little while will find that there is currently a mask bylaw in place for individuals who are walking outside in the downtown area within that municipality. It's not sufficient. A single mask, like you said, it's not sufficient to reduce the risk of transmission to a very small amount. So we're doing everything we can, all kinds of control measures put in place in order to minimize that risk of transmission down to as low a possible number as possible.
This morning I read some posts, and it's actually it is legitimate. It makes sense to me.
Okay.
We are not allowed even to bring loved ones at home, but real estate agents, they can bring a potential buyer to show my home, and this is contradicting. And there is a narration that, we Canadians, we are fun-loving people. We want to go out and have a beer. and see friends. We're socializing people. So the reason why this outside gathering, the bars closure, and this thing is to pressure us indirectly so that we will agree to take the vaccination, because most people and a lot of people are talking against the vaccine. I don't know if you are willing to go further, but I don't take you to that direction. There are some medical and chemical questions rising from people, but do you agree these measures taken are indirectly to twist our arm so that we can take the vaccine?
I can't imagine that was the intention of all of these restrictions. These restrictions are put in place to currently face the issue that we're facing, which is the risk of transmission, the risk of exposure of COVID-19 virus. And that's, it really is totally about preventing transmission right now, to get the numbers down, to get the risk for our most vulnerable individuals within the society, within their community, not to be exposed, not to then have the chance of developing severe disease and potentially die. So, I mean, we're not even looking beyond that right now. It is totally about bringing this virus in Calgary, in Alberta, under control, to protect our loved ones and our most vulnerable. In terms of the COVID-19 vaccines that are going to be available, I don't have any say or influence in terms of the vaccine policies in Alberta. That really lies exclusively with Dr. Hinshaw, who's the Chief Medical Officer of Health for Alberta. And they really are the ones in Alberta that are setting out all of the policies and considerations for vaccine in the future.
I will try to reach them out. Let me bring you back to the food or the diet part of these protection measures. What kind of foods do you think will help to boost our immune system, specifically to combat COVID-19?
So I haven't seen anything published on the Public Health Agency of Canada website specific for diet immune boosting recommendations around this virus. In general, we encourage any activities and diets which do, are healthy and are considered supporting a good immune system. So a balanced diet with fresh fruits and vegetables, and a balance of vitamins and minerals, as per the Health Canada website, which has been discussing. One of the areas that I'm specifically involved in Calgary's own AHS is environmental public health. So this time of year, we generally are very, very involved in protecting the public against pathogens that cause gastrointestinal illness, so nausea, vomiting. So viruses like norovirus or E. coli, CAMPI, and we really are seeing much less foodborne pathogens and illness right now. I don't know if you remember, to last December, we had several instances of large-scale gastrointestinal viral and disease outbreaks in Calgary affecting various restaurants. That was really the topic of the day for the interview, certainly that I was doing last December 20th to 25th. Yeah, so we're not seeing that kind of problem this year, which is, I think, down to individuals are taking that much more, paying attention and taking that much more care in the food preparation and food storage to make sure that they are reducing the chances of foodborne pathogens and bacteria and viruses. So that's a real big plus. You know, we're not seeing that kind of a problem this year, which is wonderful.
It is. We had 2 outbreaks as Ethiopian community. The first one was in a church, which I think there were about more than 100 cases. And the second one among those who are affected at the Calgary meat processing plant in High River. So a total of around 250 Ethiopian or Ethiopian descendants, Ethiopian Canadian individuals were affected, but we never had a casualty, which is a blessing, and not even a critical condition. And people say we usually eat high iron flatbread. We call it injera. I don't know if you came across. We eat Ethiopian food. That soft bread is called injera.
Yep.
It's made from a teff grain, which is 99% we say is iron. We consume garlic, ginger, grass seed, or it has another name, garden cress. Some people think that is what helped for the healing. What do you comment about that?
I'm not familiar with the specific benefits of an Ethiopian diet as what you've just described. However, a balanced diet certainly contributes to general overall health, and general overall health potentially indicates a competent immune system, which we know contributes to the body's ability to fight off infection. And so, yeah, it sounds delicious.
Well, to some extent, I took it because I know garlic is a high antibiotic.
Garlic is actually recognized as an antiviral agent. So that is known.
That would be the case then.
Now, in order to get the levels of antiviral activity that we would need for an individual, that would be a lot of garlic. It would be pounds, kilos and kilos of garlic, which I'm not sure if anyone is able to ingest, especially if it's raw.
Yeah, but it's common on our meals. So we put a slice of garlic at any time, and ginger in our tea. Even some they blend it with a juice and take it. Well, eventually it will contribute.
Overall health.
Time. Yeah. What is your advice on how to get over the pandemic fatigue?
Oh goodness. We've definitely seen a lot of evidence of pandemic fatigue, both in the broader population in general. We've seen an increase in mental health concerns of the population. We've seen an increase in levels of loneliness within communities. I think one of the benefits of the Canadian Ethiopian community in Calgary is that there is such social cohesion, that there is such support within households for one another, that the rates of loneliness, reported loneliness, are less. So in terms of preventing it, we're really struggling to identify positive actions which are also in line with the current control measures and restrictions that we have in place to look at preventing the transmission of the virus. We know that the transmission happens much, much less outdoors than indoors. So trying to do more activities outdoors, properly distanced, so greater than 2 meters from anyone else, with your household members only, we know that is contributing to better mental health and better people feeling better about the current situation. In terms of with our big snowfall in Calgary, certainly individuals who are getting out to shovel the walkways, shovel the sidewalks, physical activity outdoors is certainly encouraged, and hopefully that will contribute also to the ongoing prevention of mental health issues.
Finally, Doctor, Calgary Ethiopian Community Association and different community-based agencies or business and members, including my channel, are helping each other to provide food, rations, school supplies, laptops, and awareness. What observations would you like to make? Perhaps a comment on such organized community team efforts in supporting the nationwide movement against the pandemic?
Well, we know worldwide that those communities who can come together, can support one another with all of those supports that you've just described, are doing better. Ultimately, they're the ones that are coming out of the pandemic with stronger ties to one another, stronger community sense of care and of responsibility to one another. And ultimately, that if we can increase that feeling, then we've made lemonade out of lemons in terms of this pandemic. And so really would like to recognize the actions of the community supports within Calgary and more broadly, I mean, throughout the world with respect to community supports for individuals and populations and communities. That coming together and supporting one another is what needs to happen.
I think, Doctor, we have covered most of the topics that I thought are crucial in creating awareness, but if there is any additional information that you think you need to add, I'll give you the chance.
No, I think we've covered all the control measures, we've covered restrictions, we've covered, how to prevent some of the loneliness and the mental health side of the pandemic, and really look. I love the fact that we've ended on a really high positive note about encouraging community cohesion and care for one another.
Oh, Doctor, I want to thank you once again for being on my program to educate the Ethiopian community members here in Calgary. And I hope if I need more, I will come back and knock your door, or I have your email now, I can email to you. Yes. Thank you again. I wish you the very best Christmas and enjoy with your family. At my end, I'm done.
Thank you.
የተከታተላችሁት ከአልበርታ ሄልት ሰርቪስ ዶክተር ክሪስቲን ጋር ያደረኩትን ቆይታ ነው። እንግዲህ ሰፋ ያለ ግንዛቤ አግኝታችኋል የሚል እምነት አለኝ። ፕሮግራማችን ተገባዷል፣ ይቀጥላል። ፕሮግራማችን ተከታታዮች እባካችሁን እቺን የሰብስክራይብ በተን በመጫን ላይክ፣ ሼር ማድረግ፣ ኮሜንታችሁን ብትሰጡኝ ደግሞ የተሻለ ነገር እየመጣ ይችላልው። በሚቀጥለው በምን ፕሮግራም ዙሪያ እንድዘጋጅላችሁ እንደምትፈልጉ መግለጽ ይችላልላችሁ። ያ ብቻ አይደለም። ቻናሉን ባሰፋነው ቁጥር ብዙ አዌርነስ ያገኛሉ። አሁን ስፔሲፊካሊ በኮቪድ ዙሪያ እንስራ እንጂ ሰፋ ያሉ ዝግጅቶችን በሌሎች ማህበራዊ ጉዳዮች ዙሪያ የምንዳስስበት የሚቀጥል ፕሮግራም ነው ማለት ነው የሚሆነው። በድጋሚ ሰብስክራይብ በማድረግ ከዚህ ሊንክ በታች ያለውን ሰብስክራይብ በማድረግ ፕላስ የደውሏን ምልክት በመጫን ኦል የምትለውን ኦፕሽን ብትጫኑ በእያንዳንዱ ጊዜ ፕሮግራሞች ሲኖሩ በቀጥታ ወደ እናንተ እንዲመጣ ይሆናል ማለት ነው። በዚህ መተጋገዝ እንችላለን። ከክሳችን ስለማናወጣበት ቢያንስ ምስጋና ኪስ አይገባም ይባላል በባህላችን። another way of saying thank you to my program ልልፈልጌ ነው። እንግዲህ ፕሮግራማችን ተገባዷል ብያችኋለሁ። ከዚህ በመቀጠል በኮሮና ዙሪያ ኢትዮጵያዊ አርቲስት የዘፈነውን የኦሮምኛ ሶማሊኛና የአማርኛ ሙዚቃ አስከትዬ ፕሮግራሜ ወደ ቀጣይ ሌላ አንድ የከተማችን ላይሰንስድ ፕራክቲካል ነርስ ቃለ መጠይቅ አሸጋግራችኋለሁ ማለት ነው። በቀጥታ ወደ ሙዚቃው
Ya Rabbi ya waaqa yaa goyta suma 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 abbaan furmaata suma 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 abbaan furmaata ofeeggannoo barbaachisaa barbaachisaadha ofeeggannoo barbaachisaadha salam sinjechuu dhabuun harka siif fuudhuu dhabuun naafi siifis faayidaa qaba ofirra ittisu dhukkuba koronaa esuma dhufte ati barana koronaa way waajjiste addunyaa mara bakka namni hedduun jirurraa fagaadhu harka keessirratti dhiqadhu qulqulleeffadhu ሰላም ካልከኝ ካላልኩኝ ለኔም ላንተም አስፈላጊ ነውና እጅን ታጠብ በሳሙና ጽዳትን ጠብቅ ለመከላከል ኮሮና ለኔም ላንተም አለመጠበቅ አስፈላጊ ነውና እንዳይከፋ ቢዮ ሳቡን ኢናንጋ አንተና ኩዳቅና አገኩት ማቴ ኮሮና ደኪ ወለድ ይብቴ Corona, agekuti mate. Corona, adam pakatani taun barbaachisa, adam pakatani taun barbaachisa da. Kana hundallahu ya Rabbi ko, itte corona virus sumapura, simale hinkamnu namabira. Yesi suma abdata ya Rabbi ko ya waka ko ya goita ko furi nu suma abdanna nu suma ti oflana namu amanti saati waka yo kadate furmani ni dufa nama of the gate damaki
የተከበራችሁ የፕሮግራሜ ተከታታዮች በሳምንቱ እንደተመለከታችሁት እንግዳዬ ቀርቤ በሙያ ዙሪያ ውይይት አድርገናል። ዛሬም እንግዳለኝ ከፊት ለፊት የምትመለከቷት የከተማችን ነዋሪ እንግዳዬ ራሷን ታስተዋውቃለች። እባክሽን ራስሽን አስተዋውቂልኝ።
እሺ አሬዶ በጣም አመሰግናለሁ። ስሜ ሄለን ጌታውን ከለለ ይባላል። ባለትዳርና የሁለት ልጆች እናት ነኝ። በሙያዬ ደግሞ በላይሰንስድ ፕራክቲካል ነርስ ተመርቄ በኮሚኒቲ ነርስነት እየሰራሁ እገኛለሁ። መልካም
እንግዲህ ዛሬ የተገናኘነው በአብዛኛው የምናወራው ኮቪድ-19 በኢኮኖሚው ያለው እንዳለ ሆኖ በጤና ዙሪያ ግን ማህበረሰባችን በምን አይነት መልኩ ከምባት ያደርገዋል በሚል የተቋቋመ ፕሮግራማችን ስለሆነ ከዛ አንፃር ብቻ ነው የምናወራው ለግንዛቤ ያክል። ሄለን ስንት ጊዜ ሆነሽ ካልጋሪ ውስጥ መኖር ከጀመርሽ?
ካልጋሪ ከመጣሁ 6 ዓመቴ ነው አሁን። በ2014 የመጣሁት።
መልካም እንዴት ነው እንግዲህ መቼስ እንዴት ኖርሽ ህይወት እንዴት ነው ወደሚለው ዝርዝር አንገባም፣ ግን በ6 ዓመት ውስጥ በተለይ ከኮቪድ ጋር በተያያዘ ያለውን ለውጥ አይተሽዋል። ሰላም ነበር ኦል ኦፍ ዘ ሰደን ኮቪድ መጥቶ በጣም የሚያስደነግጥ ነገር እያየን ያለ ነው። ይሄንን ለውጥ እንዴት ትመለከቻለሽ ከማህበራዊ ህይወት አንፃር?
እንግዲህ ያው እኛ በተለይ ከሌላው ማህበረሰብ በተለየ በጣም ሶሻል ላይዝ ምናደርግ በጣም ጥብቅ የሆነ ግንኙነት እርስ በርሳችን ያለን ሰዎች ነንና እዚህ ከመጣው በኋላ በጣም ያየሁት በጣም ዌልካሚንግ የሆነ ኮሚኒቲ ነው ያለን በአጠቃላይ ማለት ነውና በቤተክርስቲያንም በኩል በተለያየ መልኩ መታገኛቸው ሰዎች ሁሉም በጣም ሞቅ ያለ አቀባበል ነው የነበረው። በ6 ዓመት ውስጥም ያየሁት ብዙም ማህበረሰባችን ጋር የተቀላቀልኩት በዛ ሁኔታ ነውና አሁን ኮቪዱ ሲመጣ ግን ኮምፕሊትሊ ነው የተቀየረው ሁሉም ነገር። ምክንያቱም እኛ ያንን ባህላችንን ለመልቀቅ ራሱ በጣም ከባድ የሆነ አታችመንት ነው ያለን ከባህላችን ጋርና ኮቪዱ ሲመጣ ቀላሉ መጨባበጥ እንኳን እስካሁን ድረስ ሚስ ይደረግ አደርጓል እንኳን ሌላው ሰው ቀርቶ ማለት ነውና ቀላል የሚመስሉ ግን በእኛ ማህበረሰብ ውስጥ በጣም ጠለቅ ያሉ ነገር ያላቸው ሁሉ ነገር ነው ያሳጣል ብዬ ነው ማስበው ኮቪድ ከመጣ በኋላ
እውነት ነው ይሄ የብዙዎች ቅሬታ ነው ምንም አማራጭ ስለሌለ ግን ያው ወቅቱ የተሻለ ጊዜ እስኪመጣ በዚህ መልኩ መቀጠል ስላለብን እንጂ በመጀመሪያ ማለት የነበረብኝ ነገር ሚስ ያረኩትን ተመልሼ ማለት ፈልጋለሁ ላይሰንስ ፕራክቲካል ነርስ ነሽ በሙያሽ ያገለገልሽ ነው በተለይ በወረርሽኝ ወቅት ደግሞ የጤና ባለሙያ በመሆን ፍሮንት ላይን ላይ የነበራችሁ ብዙ ባለሙያዎች አላችሁ ሁሉንም ባገኘሁት አጋጣሚ ማመስገን ፈልጋለሁ በዚህ አጋጣሚ እንደ ፍሮንት ላይን እንደ ወታደር እንደ ሶልጀር ነው የምናያችሁና በዛ ሰዓት ስላበረከታችሁት አገልግሎት እጅግ በጣም አድርጌ ላመሰግን ወዳለሁ
እኔም አመሰግናለሁ
እንግዲህ በመትሰሪው ስራ እንደገለጽልኝ ኮሚኒቲ ሄልት ሰርቪስ ነው የምትሰሪው ከቦታ ቦታ ከቤት ቤት መሄድ የግድ ይልሻል እንዴት ነው ታዲያ ይሄ ስራና ኮቪድ እንዴት አጣጣምሻቸው
ያው በመጀመሪያውም ስራው ቻሌንጅ አለው ቤት ለቤት መሄድ ድራይቭ ማድረግ አለብክ ትነዳለህ ከቦታ ቦታ ትሄዳለህ የማታውቀው ሰፈር ትሄዳለህ እንደገና ደግሞ በጣም አዳዲስ ሲሆኑ ሰዎች ጋር ሁሌ ትተዋወቃለህ ከኔ ባህሪ ጋር ይሄዳል እኔም በጣም ከሰው ጋር ብዙ መንቀራረብ የሚችል ባህሪ ነው ያለኝና ከባህሪ ጋር ይሄዳል ትንሽ ድራይቭ ማድረጉ ነው ከባድ አሁን ግን ኮቪድ ምንድነው ቻሌንጅ ያመጣው ለምሳሌ ከስራ ቦታ አንድ ሰው ሳይን ኤንድ ሲምፕተም ቢያሳይ ሳል ቢኖረው ወይ እንደዚህ ቢኖረው አትምጣ ይባላል ቤት ይቀመጣል እኛ ግን እነዛ ቤት የሚቀመጡ ሰዎች ጋር ነው የምንሄደው ኮቪድ ፖዚቲቭ ሆነው ቤት ውስጥ ያሉ ሰዎች ጋር የግድ መሄድ አለብን ምክንያቱም እኛ ካልሄድን መድኃኒታቸውን ማግኘት አይችሉም በቃ የየለት ተለት ህይወታቸው ላይ ኢንፍሉዌንስ ምናረክ ሰዎች ኢንቮልቭ ምናረክ ሰዎች ስለሆነ እነዛ ሰዎች ጋር ነው የምንሄደው ያ በጣም ቻሌንጂንግ ነው ለኛ ከምንም በላይ ምክንያቱም ለምሳሌ ኮቪድ ለኮቪድ ተብሎ የተዘጋጁ ቦታዎች ጋር ሲሆን ሁሉ ነገር እኛም ጋር ተሟላ ነው በርግጥ ግን ዝም ብለ አይሶሌሽን ላይ ያሉ ሰዎች ጋር ካልሆነ በስተቀር ሙሉ ትጥቃችንን አርጋና አንጋባ እንደዛ በመሆኑም አንዳንድ ሰው እዛው ጋር በቆምክበት ሊያስል ይችላል ሳር የለኝም ብሎክ ከገባ በኋላ ግን እያሳለ ልታገኘው ትችላለህ እና እንደሱ ነገሮች ቻሌንጅ በጣም አለው የቤት ለቤት ጤና ላይ ሲሰራ በተለይ
መልካም ከዚህ በፊት ኮቪድ-19 ፖዚቲቭ የሆነ ፔሸንት አጋጥሞሽ ያውቃል
አዎ
እነሱ ጋር በመትሰሪ ኦኬ እንደዛ ምን ያህል ጊዜ ኤክስፖዝ ነበርሽ ከእንደዚህ አይነት ሰዎች ጋር ለመስራት ወይ እነዚህ አይነት ሰዎችን ለማገልገል ምን ያህል አጋጥሞሻል ማለት ያው አይሶሌሽን ላይ ሆነው ተመርመረው እስከሚታወቅ ድረስ ባለው ጊዜ ፖዚቲቭ ሆኖ ኔጌቲቭ እንገባለን ማለት ነው እንሄዳለን ለመጀመሪያ ጊዜ ያጋጥመኝ ባለፈው ሳምንት ነው እስካሁን ድረስ ፖዚቲቭ የሆነ ሰው አለበት የተባለ ሰው አላጋጠመኝም ነበር ባለፈው ሳምንት ግን ተመላልሽ ሁሌ መሄድላት ሰው ናት አይሶሌሽን ላይ ነበረች ከዛ በኋላ ያው ፖዚቲቭ ሆናለች ማለት ነው ፖዚቲቭ ኮኔክሽን በኋላ ቀጥዬ ይሄድኩኝ ነው ማለት ነው ብዙ ጊዜ ሰዎች ሲምፕተም የማያሳዩ አሉ ሲምፕቶማቲክ የሆኑ ሰዎችን በቀላሉ አይሶሌት በማድረግ እንዲመረመሩ በመምከር የቫይረስ ተጠቂ መሆናቸው ሲታወቅ ጥንቃቄ ማድረግ ይቻላል ቅድም እንደተጠቀሽልኝ ግን አጠገብሽ ድንገት ሰው ሊያነጥስ ይችላል ሊያስለው ይችላል ምክንያቱም ሲምፕተም ሳያሳዩ የቫይረስ ተሸካሚ የሚሆኑ ሰዎች እንዳሉ ተነግሯል እንደዚህ አይነት ነገር ደግሞ በእኛ ማህበረሰብ ውስጥም አለ ወደ በኋላ መልስበታለሁ የኪዳን ምረት ቤተክርስቲያን አውትብሬክን ከተመለከትን የካልገሪ ሜት ፕላንት አውትብሬክን ከተመለከትን ኮወርከሮች ወይም ደግሞ ቤተክርስቲያን አብረው የሚሄዱ ሰዎች ሲምፕተም ያለበት ሰው ስላላጋጠማቸው እንጂ መጠንቀቅ ፈርተው ጠልተው አይደለም ስለዚህ በዚህ አይነት ሁኔታ እናንተ ኤክስፖዝድ ሳትሆኑ እስካሁን ጤናችሁ ተጠብቆ እየሰራችሁ ነው ያላችሁት ምን አይነት ነበር ጥንቃቄዎች ምናልባት ማህበረሰባችን አባላት እዚህ ያንን እንዲከተሉ ራሳቸው መጠበቅ ይችላሉ የሚል እምነት ስላለኝ ምንድን ነበር የምትወስዱት ጥንቃቄ ከፒፒኢ ጀምሮ ምን ነበር የምታደርጉት
በማንኛውም የጤና ዘርፍ ላይ ስትሰማራ ምንድነው የጤና መርሁ ሁሉንም ሰው ለምሳሌ ኮቪድ-19 ከመጣ በኋላ ሁሉም ሰው ኮቪድ እንዳለበት ነው ማሰብ ያለበት ለምሳሌ እኔ አንድ ሰው ቤት ስገባ ኮቪድ እንዳለ ነው ማስበው ዛቤት ምክንያቱም መርምሬ ማወቅ አልችልም ለዛ ማንንም የምታገኘው ሰው የምትገባበት ቤት በሙሉ የምታገኘው ሰው በሙሉ ኮቪድ እንዳለበት አስበክ ነው ጥንቃቄ የምታረገው ለምሳሌ 2 ሜትር አፓርት ከሆነ 2 ሜትርህን ርቀትህን ተጠብቃለህ መጠበቅ እስከቻልክ ድረስ ማለት ነው ስትገባ እጅህን በስነ ስርዓቱ ሳኒታይዝ ታደርጋለህ ራሱ ካምፓኒ ደግሞ ይሰጥሃል ለምሳሌ መቼ በ4 ጊዜ አንድ ሰው ለማግኘት 4 ጊዜ እጅህን በሳኒታይዝ ማድረግ አለብክ
እስኪ ይሄን ነገር አብራድልኝ 4 ጊዜ ማለት እንዴት ነው
ለምሳሌ አሁን እኔ ሆም ቱ ሆም ነውና መሰራው ከመኪናዬ ከመውረዴ በፊት መጀመሪያ ሳኒታይዝ ጄል ማድረግ አለብኝ በደንብ ለ20 ሰከንድ ወይንም ለ20 ሰከንድ እጄን በደንብ ሪስቴን እያንዳንዱ ቦታ በትክክል ሳኒታይዝ አደርጋለሁ ከመኪናዬ ሳልወርድ ከዛ በኋላ መኪናዬን ቆልፌ ሰውየው ቤት ልክ በሩ ጋር ከመድረሴ በፊት ደግሞ እንደገና መልሼ ሳኒታይዝ አደርጋለሁ እጄን ማስክ እንዳለ ነው ከዛ በኋላ እገባለሁ ሰውየውን ሰላም እላለሁ ሰውየው ጋር ደርሼ ያንን ለሰጠው ማስበው ነገር ለምሳሌ መድኃኒት ከሆነ መድኃኒቱን ከመንካቴ በፊት ሳኒታይዝ ማድረግ አለብኝ ከሰጠሁት በኋላ እዛው ሰውየው ፊት ወደ ውጭ ከመውጣቴ በፊት ሳኒታይዝ አደርጋለሁ ማለት ነው ይሄ በቃ የማይቋረጥ የሁል ጊዜ ሩቲን ነው ከዛ በኋላ እኔ ደግሞ መኪናዬ ጋር ከመድረሴ በፊት ደግሞ መኪናዬን እጀታውንና እንትኑ ደግሞ ሳኒታይዝ አደርጋለሁ ማለት ነው
ማስክ የምትጠቀምበትና የማትጠቀምባቸው ሁኔታዎች አሉ
አሁን ላይ የለም ለሁሉም ማስክ ግዴታ ነው
ማንዳቶሪ ነው
ማስክ ግዴታ ነው አሁን እንደውም ከአንድ ሳምንት በፊት ይመስለኛል እኔ ብቻ ሳልሆን ራሳቸው መሄድባቸው ሰዎችም ማስክ አድርገው ነው መጠበቅ ያለባቸው
አዝማቲክ የሆኑ ፔሸንቶች ማስክ እንዳያደርጉ አይገደዱም እንደዚህ አይነት ፔሸንት አጋጥሞሽ ያውቃል ወይስ ደግሞ ቢያጋጥምሽ ምንድን ነው የምታደርጊው
አጋጥሞኝ ያውቃል አዝማቲክ ሳይሆን ሲኦፒዲ የሚባል ወይንም ይሄ የቆየ የሳልና የሳምባ የቆየ በሽታ ነው እና እነሱ ሳላላቸው በጣም ሳላላቸውና እነዛ ሰዎች ከተወሰነ ደቂቃ በላይ መቆየት አይችሉም አለ ማስክ ውስጥ ሆነው ማለት ነው አንዳንዶቹ እንደውም ኦክሲጅን ሁሉ ይጠቀማሉ ቤት ውስጥ ሆነው እነዚህን ሰዎች ማስገደድ አትችልም ልታረግ የምትችለው ምንድነው በተቻለ መጠን ርቀትን ተጠብቃለህ የሚያስሉ ከሆነ ወይንም የማስነጠስ ነገር ካላቸው ደግሞ ራሳቸውን እንዲሸፍኑ መጀመሪያ ነው ተናግራለህ ማለት ነው በጣም በሚደንቅ ሁኔታ እስከዛሬ ድረስ እንደዚህ ከኛ ጋር አብሮ ለመስራት የማይወድ ወይንም ኮኦፐሬቲቭ ያልሆነ ሰው አልገጠመኝ ሁሉም ሰው እንደውም ለኛ በጣም ይጠነቀቃል እናንተ በየሰው ቤት ይሄዳችሁ ራሳችሁን ተጋላጭ አርጋችሁ ነው እኛ ጋር የምትመጡት ቤተሰባችን እንኳን ይሄንን አያረጋም በጣም ግሬትፉል ናቸው ለመናገር ሁሉም ቦታ ማለት ነው እና ኢቭን ዩኒፎርም ለብሰ ከመኪና ስትወርድ ቴንኪዩ እና መሰግናለን ለሰርቪሳችሁ ነው የሚሉትና ይሄ በጣም ደስ የሚል ሪዋርድ ይመስለኛል እንደው ከሌላው አንፃር
እውነት ነው you deserve አገር ጠባቂ ወታደር በዚህ በጤናው በተለያየ መልኩ በመሰጋገን መልካም ነገር እኛ ሀገር አንድ አባባል አለ ምስጋና ኪስ አይገባም ይላል የኛ ሰው ምክንያቱም ምስጋና ብቻውን አይበቃም ለማለት ነው በዚህ አጋጣሚ የምስጋናን ጠቃሚነት ዲናይ ለማድረግ ፈልጉ አይደለም ከዛም ባለፈ ሪዋርድ ልትደረጉ በእውነት ይገባችኋል የሚል እምነት ነው ያለኝ እስኪ ወዳለፈው ጊዜ ልመለስሽ የቀድሞ አውትብሬክ በተለይ በዛ በኮሮና ቫይረስ ወቅት ኪዳነ ምሕረት ቤተክርስቲያን አካባቢ አንድ አውትብሬክ ተነስቶ ነበር እዛ ቤተክርስቲያን ነው ተይዩ
አዎ
እንዴት ነበር በወቅቱ የነበረው ነገር ታስታውሻለሽ
እና ለመናገር እኔም ቤተሰቤ መሐልም ኮቪድ ፖዚቲቭ የሆነ ሰው ነበር በዛ አውትብሬክ ውስጥ ማለት ነውና በጣም ከባዱ ጊዜ ነበር ለኛ ምክንያቱም ኮቪድን እንደዚህ አላወቅነው ሜዛኔ ማለት የበለጠ ባወቀው ቁጥር የሆነ ሶኬ እንዲባረግ ይሄ ነገር ሆኖ ተርፋለሁ ብለተላለ በዛ ጊዜ ግን ይሄን ነገር በደንብ አጣጥመን ሳናቀው ነው ያ ነገር የተከሰተውና እኛ ሁላችንም እስከነ ቤተሰቤ ፍስለታ ጾምን እንጾማለን እና ይሄድን በየቀኑ እናስቀድሳለን እኔም ከስራ ስመለስ ወደዛ ሄዳለሁ ልብሴን ቀይሬ ተስተካክዬ እገባለሁ ልጆቼም ባለቤቴም ደግሞ ስራ አልነበረውም ይዛኔ ሎክዳውን ላይ ነበር እንትን ዝም ይልክ ሆነ በዛ የተነሳ ይሄዱ ነበር ማለት ነው እና ምንም አይነት ሳይን ሲምፕተም የላቸው ምንም አይነት ነገር አላየንባቸው ማለት ነው እና በአጋጣሚ በዚህ አጋጣሚ በጣም ላመሰግናት የምፈልገው ከኛ ጋር ኮንታክት የነበራት ሰው ግን ፖዚቲቭ መሆኗን ስታቅ ደውላ ፖዚቲቭ ሆኛለሁ እና እናንተም ከእናንተ ጋር የተገናኘሁትና ራሳችሁን ብትመረመሩ ጥሩ ነው ብላ ነገራችን ማለት ነው እኛም ሁላችንም ስንመረመር ሁለት ሰው ተገኘበት ባለቤቴና ልጄ ትልቁ ልጄና ምንም አይነት ሲምፕተም የላቸውም ራስ ምታት የላቸውም ሳል የላቸውም ምንም አይነት ነገር የላቸውም ከኛ ጋር አብረው ውለዋል አድረዋል አብረን ቡና ጠጥተናል ሁሉ ነገርና በጣም በቃ ማለት የሆነ የሚገርም ነገር ነው ምክንያቱም የቤተሰቡን ግማሹ ሰው አልተያዘም ግማሻችን ተይዘናል ማለት ነው
የፕሮግራማችን ተከታታዮች ቀደም ሲል እንደተናገርኩት ይህ ፕሮግራም እስከ 5 ሰዓት ድረስ እስከ 6 ሰዓት የሚዘልቅ ነው ፕሮግራሜን በዚህ አጠቃልያለሁ በሚቀጥለው ሳምንት ክፍል 2 ቃለ መጠይቁን ይዤ እመጣለሁ ከሄለን ጌታውን ጋር ያደረኩትን በፕሮግራሙ ትምህርት ወስዳችኋል የሚል እምነት አለኝ ፕሮግራሙን ሰብስክራይብ በማድረግ ላይክ እና ሼር በማድረግ በተለይ ኮሜንት በመስጠት ኢንከሬጅ ብንደራረግ ይህ ይጠቅማል የምትሉት መልእክት ለሌሎች እንዲዳረስ ምክንያት እንሆናለን ይህንን ለማድረግ ከዚህ ከስክሪኑ ስር የሰብስክራይብ ቀዩን ቦክስ በመጫን የደውሉ ምልክት ደግሞ በመጫን ኦል ታይም የሚለው ኖቲፊኬሽን እንዲያገኙ ይረዳልና ያን በማድረግ ማገዙ ብዙም የሚያደክም ወይም የሚያስከፍል አይደለም ስለዚህ ስለ ቅንነታችሁ እጅግ አድርጌ አመሰግናለሁ ምክንያቱም ይህ ፕሮግራም ሲሰራ ብዙ ድካም አለው ጊዜ ገንዘብ እንቅልፋት ወዴት መቀመጡን ሁሉ ያካትታል ለዚህ ሪዋርድ ታዲያ ይህን በማድረግ መተባበር ብዙ የሚያስመሰግን ነውና ይህን እንደምታደርጉ በመተማመን የዛሬ ፕሮግራሜን በዚህ መጨረሴን ላስገነዝባችሁ ወዳለሁ ሳምንት በክፍል 2 የሄለን ቃለ መጠይቅና በሌሎች ሰፋ ያሉ ፕሮግራሞች ተመልሼ እመጣለሁ እስከዚያው ድረስ ግን ቸር ያቆየን